My name is Andrea Williams. My spirit name is Megan Quay. I'm from Toronto. I'm 38 years old, and this is my son Owen Tennessee. He's 2, and my daughter Madeline. She's 12.
Hi.
I chose midwifery care for my second successful pregnancy because it was really important to me that I have community care, but also another voice to help amplify and advocate for my needs. It was also really important that I be able to have autonomy over my body during my pregnancy and to be able to have people who understood how important that was for me to be able to make decisions for my body and my baby. I had like a litany of options. I could go to the hospital with my midwifery team. I could go to the birthing center where I'd be able to have my family there in the waiting room or in the room with me.
I was able to talk to the midwives during her pregnancy, so when she was delivering my brother, I knew that she was in good hands. The midwives did come to our home a little bit to check up on my mom and my brother, see how they were doing. And we also gave him a cedar bath for the first time, and they were there for that experience.
I feel it's important for birthing parents to make the decision that's best for them. I can recommend a midwifery care because it was the best fit for me and my family. And I also had a really amazing team, so it was a beautiful experience for me. What I want to do is just amplify that birthing parents and families should be able to find and have access to what they feel the most comfortable with and what suits their family's needs.
I had 2 out-of-hospital births, one at home and one at the Toronto Birth Center. My experience with a midwife outside of the hospital, I think it was better than I could have imagined because there was a lot of involvement with my family. As I was laboring in the room, they were relaxing out there, and like when we were doing the tour, I remember that there was an area that they could sit and relax, and there was a kitchen, and just for them to be comfortable throughout that whole time. So I was happy knowing that they were enjoying themselves. But I also really liked the amenities. I liked the water, the tub, and like just the placement of it and how comfortable it was. Just the whole thing was really nice. And then at home, I had the entire family there, and I controlled the environment that I was giving birth in. You know, people were in and out of the apartment. I originally thought that wasn't a possibility unless I had a big home. Talking to the midwife, I think she told me that was a possibility. I told her I live in a very small apartment. I don't know if it's possible. I don't have the tub that I dreamed of. I know that the midwives would not have offered it if they thought that I was at risk in any way. It was a different experience than what I thought. I tell everybody about it now.